So this video is going to be a little bit different. I'm going to react in real time to a couple clips of Andrew Shulz talking about his child. I've been sent this clip a few times, and I have a personal story for a little bit empathizing with what he's talking about. And then the final clip is going to be something that's absolutely hair-tingling gross that has to do with medicine and childbirth as well. So stick around for that one. That is a little bit hair-raising. But let's get into the first clip of Andrew Shulz. I got it pulled up here. I'm going to watch it live with you here. I'm going to react in real time at the end.
It's very easy for people who don't have kids to tell you, like, oh, just trust the doctors, whatever. The second you have a kid, it is probably the most terrifying thing you'll ever do in your entire life is injecting something into the most perfect thing you've ever created. And then every single day wondering and seeing if she's still smiling and seeing if she's still okay, like, and feeling responsible if anything negative happens.
Right.
And then if you don't do it, feeling responsible if she got fucking the measles or mumps or whatever it is. I have so much more empathy, and it's something that people just can't understand because they're not put in that position.
Right.
And every new parent that I talk to is concerned about this shit. Every single one. So it's like you have to have a little empathy. Like, you've created the most perfect thing you've could ever imagine. Like, nothing comes as close to that. And every decision you make could greatly impact that person's life. So yeah, we're going to be scared if we watch video on the internet that says this thing is bad for them.
Right.
And don't call us some quacks. Just call us like parents who care for kids.
So this is actually a very interesting take here by Andrew. So Andrew's basically saying that, hey, when you have a kid, you have this hyper oversensitization to anything that kid, that baby, that newborn eats, gets injected into them. And he's specifically talking about vaccines and vaccinations in general. And I myself, as a physician and also a father, have a story on the back end of this. When you have a child, there's no way to prepare you for what kind of emotional attachment you're going to have to that kid. When we had our first child, I was scared out of my mind. He was born with a medical condition that didn't allow his body to clear out a certain byproduct in his body as fast as should be done. And when you have a baby, everything inside of you, it's like God reaches down and flips a switch that makes you love that baby more than anything you could have loved ever before and ever after. You know, you say it a lot as human beings that, hey, I would take a bullet for this person, or I would take a bullet for this individual. But it really doesn't hit home until you have a child. When you have a child, you really feel like, hey, I would trade my life for this person. Now, being a physician and knowing everything that can go wrong, when we had our baby at one of the top university hospitals in the entire country, I'm talking about the top of the top we had our son at, and he needed frequent blood draws. They did a scanner over his head for the first 48 hours or 24 hours. I can't remember the exact timings. But afterwards, if the numbers still came back high, he needed a blood draw. And I was absolutely scared out of my mind, being an anesthesiologist, knowing how hard it is to get a blood draw from a baby. We place IVs when babies have surgery, and that takes multiple attempts, and sometimes it doesn't even go as planned, and we need to place an IV in a big vein inside your neck or inside your groin when you're a child because your veins are so tiny, and getting a little catheter inside of those veins to take blood out of is not easy. So when they said that they're going to send up a PA or a nurse practitioner or first they said there's going to be a nurse that's going to draw his blood. I immediately said no. I said I would not feel comfortable as an anesthesiologist taking blood out from a 2-day-old. I do not want a nurse to be attempting to take out blood from a 2-day-old. I would like somebody of the highest level of care, and they then pivoted the person who was going to draw the blood from a nurse on the labor and delivery floor to a nurse practitioner from the NICU, and I felt a lot more comfortable about that. And I only said that because I knew what the ramifications were, and I was a patient advocate because I'm an anesthesiologist. I take care of critical care patients all the time, and an average patient coming in doesn't have that knowledge base and also doesn't have that autonomy to be able to request higher levels of care, because in that moment, you're obviously very scared when you're fearful for your child, as I was in that moment. I did not want to give up any control, and so even when his blood draws were being done from his foot using a little puncture mechanism where they just tap the bottom of the heels and they squeeze out the blood, I felt the pain that he was feeling, and he was, 2 days old, so he had no recollection or idea of that pain, but I could see it, I could feel the pain, and that really made my blood boil, like I couldn't fix it. And so in this clip, Andrew's talking about vaccinations and the fear around vaccinations. And even in that moment, when we first had our son, and I I was in the position of deciding whether or not he should get vaccines, whether or not he should, get the test that he needs to get, the blood draws that he needs to get. I was hesitant. And even as a medical provider, somebody who is an avid supporter of vaccinations, I was hesitant. And that's being completely honest. And that's coming from a position of love and care and fear on my own end because, I didn't know he's right. When you watch a video online, especially one that goes viral, when you watch a bunch of videos online that say, hey, this is bad for you, getting this vaccination is going to cause X, Y, and Z syndromes afterwards. This is the cause of autism. This is the cause of trouble sleeping or trouble with anxiety or depression. When you see those videos, even as medical providers, they hit home after you see 4, 5, 6 of them, and you get scared. And when you have a vulnerable child, you are very afraid of putting something into their body that, somebody on the internet somewhere said that it was bad and it got 1 million views. And if it got 1 million views, that means it's probably correct, right? And so unfortunately, we are subject to the same types of anxieties that come along with it. So I absolutely empathize with patients, with parents, with children who have these questions about vaccines, about injections in general, because in that position, and that being said, our son got all his vaccinations. We didn't pull away from him, but I did feel that turmoil and that anxiety. And as a medical provider, if I feel that turmoil and anxiety, I can only imagine what a non-medical provider would feel like, what a non-medical person who has a child would feel like in that moment of anxiety. And unfortunately, in today's day and age, we have a lot of those because of social media, because it's very easy to go viral if you say something that's controversial, right? It's not as easy to go viral if you state the facts. And so we are not immune as healthcare providers to being influenced by social media as well. And so I just wanted to emphasize that the reason why I try to take the middle ground and the approach that I take with social media is not necessarily because I am trying to play both sides or whatnot. I've been in those positions. I have had those thoughts. I've had those ideas where I wasn't sure of the science. I wasn't sure of the medicine. I wasn't sure of what I had been taught. Had everything I'd been taught been a fallacy? And so if I myself went to that position, I can only imagine that a non-medical person would go to that position and go past that position. And the only way to kind of rationalize and educate and connect with those patients is to understand where they're coming from. And sometimes as medical providers, as doctors, we don't do that. We kind of believe that we know what's right and we kind of dictate that toward our patient populations. And unfortunately, that leads to more detrimental results on the back end as opposed to on the front end. Now let's get into the second video that Andrew Shulz had, which is also about children as well, and I'll react on the back end.
A new doctor came in from another floor and was like, hey, I'm here to check on the baby. And I was like, can I see some ID or something? Like, in my brain, I jumped to the conclusion that she was going to steal the baby. In the way that, like, if you pour water over cobblestone, you know how it will fill every space? Yeah. That's what the love for the kid feels like. It just starts to seep in, and then this weird, like, protective instinct comes in. So I didn't let her in, and I asked the guy who managed the floor, and I was like, do you notice? I'm looking at her shoes. They all wear these like Calzeros or something like that. They're a version of a Croc, but it's a different type. It's a fancier Croc. This coming in with New Balance. I'm like, hold on. She ready to run with my mother baby, long distance. I'm like, not my baby. But then, yeah, she did work there. And yeah.
So that's actually very funny. I had a similar experience when we were with the new baby. There's a weird, like I said, there's a weird switch, a weird hyper alertness that turns on when you have a child, that it doesn't have to be new, any person that comes in contact with your child, and especially as your child is growing, you are hyper aware of, hey, what's their intentions? What is the worst that can happen? And being a medical provider and knowing the worst that can happen and seeing the worst that can happen. I mean, I can go on, a myriad of stories of moms whose boyfriends, hurt their children and they didn't even know about it, or physically assaulted them, or stole their kid, or left with their kid. And there's this weird part of your brain that turns on that's like, hey, I am thinking the worst in people. And so I am not... I'm not here to say that is wrong. You should be hyper vigilant. You should ask questions when you're having a baby, when you have a child, when you are in the birthing process. You have the right as a patient, as a parent, as a person to ask for ID, to ask who this person is, to ask other people, should I trust this person? And in fact, I encourage it. I think in today's day and age, with as much misinformation and anxiety that's out there just in the world, I encourage patients, people, to ask questions, especially in the medical field, because as providers, as an anesthesiologist, as a surgeon, as a cardiologist or an OBGYN, we're trained to deal with scenarios that are unusual, right? And we are not very much open to receiving questions out of the ordinary. And not necessarily open, but maybe we don't facilitate that environment. And unfortunately, that is to the detriment of the provider and the patient. I think going forward as a society, as medical providers, even as a general population, we should be more open to asking questions, better understanding what the risks are with procedures, what the risks are with having your patient or your baby or your person being having a medical evaluation, a medication started. What are the long-term effects of this medication, of this vaccine, whatever it is? You should ask the questions, and you should not be judged to ask those questions. So I think as a society, we really need to move toward that. And I only say that because I've been in that position. As being a father, a brand new father, I felt that anxiety with all sorts of the parental process. Even when we go in for our annual vaccines or our annual checkups or our annual whatever it is, I feel anxiety and I feel almost a pressure not to ask questions, even though, because I am a physician, so I should know the answers, and I can only imagine what that is for like a patient who comes in and wants to ask all these questions, but is afraid of being ridiculed as dumb or, extremist or a right winger or a left winger or whatever it is. And today's society, I think we got to bring everybody more toward the center. So that's my opinion on that. Now, the final video is a little bit gross, but it's worth knowing and it's worth seeing. So let's get into that one.
This is how I cooked my husband placenta spaghetti. I started by cutting the meat with scissors because it was really tough. I seasoned it with salt and added my pasta, and then I added the olive oil, and then I cooked the meat and the pasta and the sauce for a better flavor.
Okay, so there is this idea in society that if you eat your placenta, whether it's culturally or, I don't know, a new age way of thinking, that it could potentially increase the vitamins and minerals in your body after having a baby. It could potentially increase your breast milk production with the oxytocin that's present inside the placenta. And finally, it helps with postpartum depression. There have been studies that have proven this to be absolutely incorrect. They tested women after eating a placenta to see how their moods were doing, and they found that there was no difference whether you ate your placenta or didn't eat your placenta. They tested the bioavailability of common vitamins. Vitamin B12 and a bunch of the vitamin Bs are touted as being present in the placenta, which are necessary for growth of the baby and the placenta. But eating them doesn't really change the total number of vitamins and minerals inside your body. And the last one, the oxytocin and pitocin causing breast milk, they tested that as well, and they found that there was no increase in lactation if you eat your placenta. Now, I want to jump to the first. It's gross. Eating your own body's byproducts. It sounds like almost cannibalism. I don't know. It's or self-cannibal. I don't even know how to describe it. It's just. It's not meant for human consumption. There is a very big risk if you don't treat the meat properly and refrigerate it or whatnot that you can get group B streptococcus, which can be very lethal to you long-term and cause septicemia, infections, all those kind of things. I would highly, highly suggest if you're going to do this to at least refrigerate the meat. And I say meat in quotation marks properly, but in today's day and age, I think that it is probably not the best idea to eat your own placenta. What do you guys think? Leave a comment below. I love you guys. I'll see you on the next one. Oh, and if you guys can, please like and share and subscribe. Do all those things.